Well, I am delighted to be here at UIC's College of Medicine. As you know, my father was Abraham Low, and it was at the UIC Psychiatric Institute where he developed the recovery program back in the 1930s. Because the recovery program has made a huge difference in the lives of just about everyone who has come in contact with it, I would like to talk about how Abraham Low developed it and the difficulties he encountered in trying to get it recognized as a valuable system of self-help in the mental health field. Abraham Low's original field of medical study was actually neurology. He came to the University of Illinois College of Medicine in 1925, and for the next several years he did research in neurology. Then in 1931, the Psychiatric Institute was opened in the College of Medicine to do research on patients with various mental illnesses. The patients were selected from hospitals around the state and brought to the Psychiatric Institute for treatment. The head of the institute, Dr. Harold Douglas Singer, some of you may have heard of him, knew of the research work of Abraham Low and wanted him to develop the medical research at the Psychiatric Institute. Low was innovative from the start, and Dr. Singer was very supportive of Low's endeavors. Low knew that psychoanalysis, the prevailing treatment at that time for mental illness, couldn't work with so many patients, and he didn't believe its concepts and treatment methods were effective. He realized that with so many patients at the Institute, rather than always dealing with them individually, he could treat more of the less severe ones by meeting with them collectively. Thus, he started an early form of group psychotherapy. He also knew that lecturing the patients wouldn't work well, but interviewing one and then giving an explanation while the others listened could be effective. He strongly believed in the power of words and always kept his interviews and explanations very simple so that his patients could grasp the concepts. He was innovative with the treatment of the severely mentally ill as well. He introduced shock treatments at the Psychiatric Institute, and the dramatic improvements which resulted enabled him to treat them with the same techniques he used on his less severe patients. It also convinced him more than ever that psychoanalysis was not the path to follow. His primary focus was getting his patients to change their thoughts and control their impulses, which, as you know, is now referred to as cognitive behavioral therapy. As Low's patients continued to improve and be released from the hospital, it became evident that life outside the hospital was very difficult. The stigma of mental illness prevented them from communicating with other people, being able to get jobs, and even reintegrating back into their families. In the fall of 1937, several of Abraham Low's former patients came to him asking for help in dealing with the stigma. He set up a meeting with them for November 7th, and that was the beginning of what was to become the Recovery Organization. The organization at that point was intended to serve three purposes. The patients could talk freely with each other and share experiences. Dr. Low could observe their progress, and they all hoped in some way to educate the public about mental illness and eradicate the stigma. One thing that recovery members missed when they came back to the hospital for meetings was the group psychotherapy they had experienced when they were in the hospital. So Dr. Low set aside time to periodically conduct psychotherapy sessions for them in the Psychiatric Institute. In the summer of 1941, Recovery left the Psychiatric Institute, moved to downtown Chicago, and became an independent, non-profit organization. From that point on, it was really the recovery members who were instrumental in growing the organization. First it grew by word of mouth, then it started getting publicity, and then it started getting referrals from physicians. As recovery expanded, Abraham Low worked on developing a structured meeting format that could be used by recovery groups anywhere. In 1952, he finalized that format and then turned the recovery organization over to the patients as a truly self-help organization. Eventually, recovery spread throughout the United States, Canada, Puerto Rico, and abroad. During the past 7 years, we have developed a simplified version of the program, which we call the Power to Change. The program is currently being used in the Chicago Public Schools, the Lake County Jail, the Los Angeles County Jail, and we are now starting to offer it to veterans. The possibilities for the program appear to be endless, and it all started here at the UIC College of Medicine. It is an honor to be here today, and I thank you so much for inviting me to speak.